Hello, namaste. My name is Ranjana Pradhan and it's lovely to be back. This video today I will particularly focus on any issues relating to the lower back. If you already have problems or you're wanting to prevent any injuries to the lower back, these are certain asanas that I will present to you that will definitely help you. I'm not going to do this in real time, but you can take your time, pause the video and do the asanas at your own pace and rhythm to how much ever long you wish to, or whichever asana that suits you. I'm just going to introduce you to a couple of asanas, maybe about 7-8 of them that will particularly focus on your lower back. Before I go into asana practices, I want to let you know that the lower back is not in solitude giving you issues or problems. The lower back problems could be because of the tightness in your hamstring, behind your thigh, your quadriceps needs a lot of strengthening and flexibility as well. The mobility around the hip region, the hip flexors here, and your glutes. The glutes also play an important role in stabilizing your lower back. Also the spine, if your posture isn't correct, it eventually leads to discomfort, pain or injuries in the long run in the lower back. So these postures will help you to recover in your get you into the correct posture in your everyday life. It is not just on the mat but off the mat as well, to get you into a correct posture, show you how you can engage, activate, mobilize and stabilize the different muscles and joints in your body that will lead and help you in resolving the problems in your lower back. So let's get to it. Okay, first of all, we will begin with the posture where you lie down on your back. Remember, when you're on your back, to always tilt your tailbone pointing towards your leg so that your lumbar region is pushed into the mat. Make sure there is no gap between the back, or if you think there is a gap, you use a rolled up towel or a cushion or even a yoga mat under your back to just give you that relief before you go into the posture. So if you can and know how to tilt your hip towards your ribs, ribs towards your hip, and engage your stomach muscles, your buttock muscles, and push your lumbar back into the mat, then you do that. Otherwise, use something to help you keep your the gap between the mat and the back away. Yeah? So lying on the back comfortably, again be mindful of your breath, your movement, and slowly try to lift your leg up. This is a very effective posture because all through the day your legs are carrying the weight of your body. Whatever weight it might be, whatever you might be doing, it is the legs that take a huge amount of pressure of the entire body through the day. Yeah? So we give it a break, and this is a good practice. It is not very passive because you're activating your leg muscles, you're feeling the weight of something on your heels, and you're pushing your lumbar back into the mat. So you stay here every day for a minimum of 5 minutes to go up to as much as you can, and you will see a gradual relief in the lower back region. Yeah? Second, you drop one of your leg down and the second leg pull it up towards your chest. The gravity will help you to decompress the pressure that is in your lower back. So activate both your legs with your toes extended out in front of you and gradually pull your knee to your chest. This is called Pavan Muktasana in our yoga practices. You do this in both the legs as long as you comfortably can. And if you can, also pull both your knees to your chest. You can even have somebody in the house who's of lighter weight to sit on your knees. So it goes into a more intense decompression in your lower back. So you stay in this position for as long as you can. Again, people with stomach, big stomach, pregnant women who cannot go into this, can take your knees away and drop your knees to the side. So the heels facing up, you can gradually pull your knees towards the side and still give your lower back a decompression and relaxation. Yeah? So this is a great posture on your lower back. If you need a little bit of a dynamic practice, then go into Setu Bandhasana, the bridge pose. Now here again, I always advise students to divide the vertebrae into 3 portions: your lower, mid and the upper back. So when you're going into this posture, you're pressing your feet into the ground, activating your buttock muscles, tightening them, engaging your stomach muscles, and as you're inhaling with control, first lift your lower back, then your mid back, and then your upper back. Do not go 100% up to the range of motion. Take to about 80-85% there and feel the work that you do on your hip flexors, which will help in strengthening the lower back muscles. So stay in this position, also great for your quadriceps and strengthening the muscles, which eventually will help you strengthen your lower back. If you want to go deeper, you can even extend your leg out in front of you one at a time. So as you intensify your practice, you can do that. Or to begin with, feel this and always remember your tailbone pushing down towards your feet, your stomach muscles engaged. So you have this posterior pelvic tilt. Yeah? So activating them, you can stay here for as long as you can. Setu Bandhasana. So these are very common but very effective practices you can use in your everyday practices. Then you slowly roll down on your stomach. Again, one of the very effective practices everyone advises. You can have your elbows touching each other. Place your chin on your hands. Tuck your elbows down inside your chest and stay in this position for as long as you comfortably can. You can even bend one knee at a time towards your buttocks. And do your relaxation recovery in the house in this position, which will slowly help you to build up on your lower back. If it's the upper back, just move your elbows forward, touching each other, and stay here in this position. Great relaxation and recovery as well. Yeah. Now we go into Bhujanga Asana, again a very effective practice. Get your legs together, hands beside your shoulder or your chest, chin on the mat. Do not put any pressure on your neck region. As you inhale, take a deep breath, fill your lungs with air, and keeping your hips and your belly button on the mat, lift your chest above the mat. Do not go too high. Your elbows are bent and tucked in towards your ribs. Make sure you're not in this position. Your ears and your shoulders closed. Ensure you're dropping your shoulders down, elbows pushed back, and your ears are away from your shoulders. So Bhujanga Asana. This is a Saral Bhujanga Asana. If you want to intensify, gently go into Triyak Bhujanga Asana, where you rotate your body and look at your opposite side of your heel. Come back to the center, inhale, exhale, rotate to the other side, looking at your right heel if you're turning to the left side. Your elbows are bent, shoulders pushed down, and chin lifted up. Exhale, slowly lower down. So Bhujanga Asana, one more practice lying on your stomach, Salab Asana. Again, filling your lungs with air, gently lift your upper body up, lower body up, toes touching each other. Now extend your arms towards your toes. Stay here in this position for as long as you can hold your breath and gradually recline. Make sure you're not extending your neck too much. Take it as much as you comfortably can. Look to the front of the mat. Be comfortable and then lower down. Okay, the practice on your knees. Push your hands into the mat. Lift your body up. Go into Shashanka Asana. Hair pose. Okay, you can keep your knees together if you can. Touch your forehead on the ground. Otherwise, you take your knees slightly away. Make sure your forehead is rested on the ground. Elbows lifted up. Walk your fingertips out as you lengthen your upper back and your shoulder region, as well as decompressing your lumbar region. This is Salabhasana. This is also a recovery, relaxing position in many of our yoga practices. You can go into Balasana by taking your hands towards your heels and staying here like a baby would relax. Drop your elbows and shoulders down to the side, direction of the mat. So you create this decompression in your back region for as long as you wish to and can. If your stomach is huge and pregnant, take your knees away and create that space between the mat and your abdomen. Okay, this is some of the practice. One, then you can go sitting down. Place your heels against each other. Make sure you're not rounding your back. You're pushing your abdomen towards your legs. Interlace your fingers, place it down under your toes, and start flapping your knees down. As you push your chest out, relax your shoulders. This goes into Baddha Konasana. And if you want to intensify your practice, slowly take your forehead or your chin down to the mat. If you wish, or if you have any knee problems, do not close this gap. Take your knees, heels slightly away, create a little bit of a gap between your thigh and your calf, and then gently take your body down. Okay, so do this and stay here for as long as you can. Keep breathing. And gently come back up. Two more practices I'll show you. Keep your knee bent, take your right leg back. We go into the pigeon pose. See if you can try to get your knee and your heel in line with each other. It's fine if you cannot, but if you can, it protects your knee if you're repetitively doing the practice. And slowly pull yourself, your hips down. Make sure you're not putting pressure anywhere. This is a practice where you're working on your hip joints and your hip flexors around the right side. Your buttocks are engaged and activated. You stay in this position for as long as you can, or slowly go down and relax your forehead down. It's not passive because I said relaxation. The action of pushing your right hip forward and the left hip back is an ongoing thing in your head. So keep pushing your right hip forward, left hip back. So that action is there. The rest of your body is in a relaxed position. So again, stay here for as long as you comfortably can. Yeah, one more practice. You slowly repeat this on both the sides when you're doing any one-sided practice. Yeah, make sure you balance your body and your center line is in place. Come up into a lunge. Transfer your body weight on both sides. Your front on the back. Remember your pelvic tilt. Do not go into an arch in the lower back. Make sure you're pulling your hip region, your hip flexors up, your tailbone down. Remember pushing your hip towards your ribs, ribs towards your hip. Okay? So in this same manner, you can push yourself slightly down, but don't go too far down because it's going to take a compensation on your lower back. So stay in this position with work doing on the hip flexors, hip region, your buttock as well. So be comfortable in this position. Place your hands on your waist so you can check on your posterior pelvic tilt, and slowly lift your heel up towards the buttock. Balance yourself. And now gently, when you're ready, take your hand back and pull your heel towards the buttock. So this entire work you're doing on your hip region, hip flexors, quadriceps even, and stay here, normal breath in and out. And release very mindfully, hands on the mat, protract your shoulders, push into your palms, round your back, lift your knee up and take your leg back into Adho Mukha Svanasana. One last practice. You walk your leg to the front of the mat, lie down on your back, cross your leg, your heel on your left other side knee, and gently pull your knee towards your chest. Okay, stay here again for as long as you can. Your right elbow can push your right knee out. So you're going into an IT band stretch. Keep breathing your normal breath and release. Cross your leg completely. Extend your right hand to the right side. Look at your right finger. With your left hand, slowly pull your left knee down, right knee down towards the left side. So giving your lower back a twist. Make sure your shoulders are grounded into the mat. It's okay if your knees don't touch the ground. Make sure your shoulders are grounded. Okay, if you want to intensify your practice, slowly extend your right leg, hold it with your hand and straighten it out. Make sure your pelvic floor is stable, your hips are square and straight. Now you can bend your left leg and hold it there. Yeah, just intensifying, otherwise you just stay in the twist for as long as you comfortably can. And gently release and repeat on the other side. Now pulling your knees to your chest. If you can do this practice, again when you're doing this, do not put any pressure in your neck to lift it up. Use your abdominal core region, the entire belt around the abdomen and the back. So you're pushing your rib cage towards your hip. Slowly rock yourself to a seated position. No pressure on the neck, you're only using your rib cage to be pushed towards the hip. So this will act as a great strengthening and stability practice for the lower back, but make sure you're not compensating in other regions of the body. Just gently rock and roll and relax. That was all the practices. Again, I've just done one side of the body in a short frame of time so that you can take it at your own pace and see how it goes. Work on strengthening your thigh because your hamstrings could be tight, on loosening up the hamstrings, keeping your glutes very strong and active. And as much as you strengthen your core region, the less problems you have on your lower back. So good luck with your practice and the journey to get a better and a stronger lower back. See you around next time.